Hello, I'm Dr. Brandon Gibson, and today I want to talk to you about what is peripheral neuropathy. Now, I know I've done videos on this before, but I'm thinking I can take this into a little bit more depth because of the way we're doing this over the next 90 days. So, what is peripheral neuropathy? As you know, we've talked about the peripheral nerves. You know that there's the central nervous system, the peripheral nervous system, and the peripheral nerves are everything that's not in the brain or spinal cord, and includes sensory, motor, and autonomic nerves. So, basically, peripheral neuropathy is a condition where the nerves are not working like they're supposed to, where they're actually malfunctioning in any one of those pieces or all of those pieces or any combination thereof. So a peripheral neuropathy could be a sensory neuropathy, and it could be the small nerves or the large nerves, so small fiber sensory neuropathy or large fiber sensory neuropathy. It could be the motor nerves, so it could be the fact that the nerves that are going to the muscles are failing, and you're getting a neuropathy because of that. It could be the autonomic nerves, where they're failing and not working like you're supposed to, and that could be an issue. So when it comes to peripheral neuropathy, there are several different pieces that you need to determine. One, we talked about. It could be, is it sensory, motor, autonomic, or does it include more than one of those, or even all of those? Is it single nerve, mononeuropathy, or a polyneuropathy, which is multiple nerves? Is it symmetric? Is it the same on both sides, both legs or both hands, both arms? That is an important question. That is important information to have. So you've got what nerves are affected. Is it a single nerve, multiple nerves? Is it symmetric? So if it's multiple nerves, is it the same on both sides, or is it different from that? And then what type of malfunction are you having? Because truthfully, you can have where the signal is completely stopped. So if you were to cut a nerve and you stop the signal, where you're getting no signal, that would be a type of peripheral neuropathy. It's not very common, but it is one of the types. You could have a damage to the nerve cell itself, so the neuron or the mitochondria in the neuron, or the myelin sheath, which is the lining of the nerve, or the axon or dendrite. So is it the portions coming into the nerve, the portions going out from the nerve? Where is the damage happening, and does that cause a weak signal or a slow signal? Because that's the other way it could be. So you could say, okay, you've got no signal, a weak signal or slow signal, and you can even have a normal signal that's erroneous, that's actually sending in such a way that it's not getting the right information to the brain. And so any of those will actually cause a peripheral neuropathy. Absence, weak or slow, or erroneous. And the peripheral neuropathy symptoms will typically be a little bit different depending on what type of signal they're getting. And you may actually have a combination depending on the type of sensation. So the other piece of this is having a peripheral neuropathy does not mean that all sensations are messed up or all portions of that nerve are not working like it's supposed to. It can be any piece of that. Because of that, you're getting some pretty significant variance in the way that it presents for different individuals. So it can actually be pretty different. The other piece of this that is usually not considered. So we're saying, okay, we've got all the peripheral nerve influence pieces, but there's also a central nervous system portion of peripheral neuropathy that is usually not considered. And that is the way that the brain is interpreting the signals that are coming back. And so this could be, because it's an erroneous signal, the brain doesn't know how to interpret it, so it's interpreting it wrong. It could be that you have the pain neuromatrix in the brain, or basically a pain neuromatrix is like a map in the brain. So if you had a map and you've got a GPS that's trying to tell you where to go on that map, then that's like the pain neuromatrix, where that GPS is influenced by your environment, by the way you were raised, by your past, by your fears, basically even previous sicknesses or previous injuries or previous trauma or whatever. All of these pieces play into your neuromatrix, your map, and that GPS has to go through that, and a lot of times we'll interpret it as pain, discomfort, and even can become a disability. So with all of those pieces together, that is peripheral neuropathy. That is the reason that peripheral neuropathy is so unique. That is the reason that peripheral neuropathy needs to be studied very, very carefully. That is the reason that you want to work on this with doctors that can help you understand. The key to peripheral neuropathy is you understanding peripheral neuropathy, you understanding your peripheral neuropathy, how it differs from everybody else's, and then work on managing the symptoms, and also work on stopping the damage, and ultimately learn the tools that are necessary so you can thrive and really enjoy your life. So if this is something that's important to you and you say, okay, I didn't understand all that about peripheral neuropathy and I need a little bit more information, I invite you to join us for the Gibson Method 90-Day Boot Camp, where over 90 days we can give you that information. We can help you truly get the information that you need. This is Dr. Brant Gibson, and this is your Neuropathy Nugget Day 213. What is peripheral neuropathy? Hope that gives you more information and can help you start on that pathway to truly understand and truly manage your peripheral neuropathy.